everyone, this is Troy with the Advanced Spine, Joint, and Wellness Center here in Medina. Welcome back to our podcast once again. Hey, if you caught us last week, we had an amazing doctor on and a world-renowned surgeon talking about the OLLIF procedure. So if you had caught that and or were trying to get in touch with the physician, feel free to reach out to us, comment or instant message us. We'd be happy to get you that information. Fantastic interventional fixation of the spine for sciatica, spinal stenosis, etc. So, welcome back. This week we're going to talk about occipital neuralgia. Some people may have heard this word before. Maybe some of you have it, and perhaps it's been diagnosed as migraine headaches, and maybe some of you have it and don't really know, that you do have it, although you might be experiencing the symptoms and they're bugging you, and you just didn't know what it was or what to do about it. So today we're going to talk about occipital neuralgia, but before I get there, if you're looking for us, easiest place to find us is to go online and just simply search Ohio Pain. So you can just go to ohiopain.com. That'll take you right to our website. Of course, you'll see on there we have chiropractors, physical therapists, relationships with just about every orthopedic surgeon here in Northeast Ohio, massage therapists, and a whole gamut of things to help with whatever the problem, but the goal is just keeping you off of pills and trying to keep you out of the hands of some of these amazingly talented surgeons that we have great relationships with. But if needed, we'll send you there. Watch the podcast on Ryan Leathers. That was a good one talking about a surgical referral. If you're looking for us on Facebook, of course, you can find us at Advanced Medina. And then Instagram, you can go to advanced_spine and find us on Instagram. And we even have a pretty robust YouTube channel. If you want to check this video out, you can also go over there. So let's talk about occipital neuralgia. What is it? So occipital neuralgia is a very common headache that is seen in people who are commonly sitting at a computer for a long period of time, on screens, tablets, phones, perhaps have been doing this for years upon years, and people that drive very frequently. So people that are just kind of getting into a lot of these forward positions, forward postures, kind of looking down frequently throughout our daily life. And what happens is, high up in the cervical spine at discs number 1 and 2, which are right at the base of the skull and the spine. So right in this area, right where the skull is going to meet the top of this spine here, at C1 and C2, there's a nerve that comes out, and that nerve is going to come along the base of the skull over here, right behind the ear, and it's one nerve right here, but what happens is, as it comes behind the ear through this little soft divot, it branches, and it turns into what's called the lesser branch, or lesser occipital nerve, and there's a large branch called the greater occipital nerve, which comes up from this notch, radiates up over the head, and is literally right at the eyebrow area. The other one comes right up over the ear, right into just behind the temple area, and that's the occipital nerve. Now, occipital neuralgia is irritation of this nerve, and irritation of this nerve can happen for a lot of different reasons. Number one, and the simplest reason for it to occur, muscle tightness, tension. And muscle tightness and tension can occur for a lot of reasons. Again, all the things that I had listed that people commonly do can cause a lot of muscle tightness and tension through some of these supportive muscles through the neck and upper back, in particular the trapezius, which is a large muscle that attaches at the base of the skull and is under tremendous tension with these forward head postures. And nerves oftentimes, and most of the times, live in muscles. So they travel through muscles, and muscles are designed to have little splits in them for the nerves to go through. But that being said, sometimes the muscle gets tight, which can then pinch the nerve. And if we pinch the nerve, then wherever that nerve goes, we're going to experience symptoms. So one of the areas where it can commonly be pinched and irritated is right at the base of the occiput behind the ear, in that little soft spot. And if those muscles get tight and we pinch that nerve, wherever it goes, we might experience symptoms. For instance, sciatica, a common thing that we treat. We pinch the nerve in the spine or in the rear end, and wherever that nerve goes, we feel symptoms. So pinch it in the spine, you can feel pain shoot all the way down the leg. Pinch this guy here, we can see symptoms radiate up over the head or into the eyes or ears. Symptoms also can generate from the spine or the upper spine, so the cervical spine. Way high up, these two vertebrae are very, very commonly misplaced. And that can occur from, again, just forward head posture. That can also occur from old traumas, and most commonly, what we're going to talk about next week, car accidents. So many people following car accidents have these residual headaches that oftentimes can last for years. Military service members like myself, that some of those guys over there that were really in some of the deep stuff, getting blown up, jarred around. I jumped out of airplanes for a living, had a few head injuries with bad landings. And what can happen is we get some rotation of these vertebrae high up top. And I don't know how well you can see this on Facebook, but if we look at these vertebrae here, this is a game of millimeters. And if these vertebrae just rotate ever so subtly, just a millimeter or two, we start to pinch the nerve. And we can see these vertebrae extremely well, which are right behind my mouth here in the spine. And by doing a good open mouth x-ray, we can see these vertebrae and what their alignment is like. And we can see, is there significant rotation of those vertebrae that are pinching nerves, and or if we do really good MRI CT scans, sometimes disc herniations or disc problems up top, disc degeneration. So oftentimes occipital neuralgia can be generated in the upper cervical spine, very common, or through the muscle tightness and tension right behind the ear. And the treatment for it is really based on the clinician's kind of intuition as to the cause, the source, how long it's been there, etc. But treatment can be very effective if diagnosed correctly. Now here's the key. Too many people with occipital neuralgia get diagnosed with migraine headaches. And that's when we typically as providers do a poor job of listening to historically what your headaches feel like. Number two, where do they generate from? And number three, what are some of the associated symptoms? So if you have migraine headaches or you've been diagnosed with migraine headaches that are refractory to conservative care, meaning they're not responding to conservative care with all these medicines, and we see this all too often, where all we've ever done is just take medicines for the headaches and they just don't get better. And oftentimes it's occipital neuralgia and they are not going to respond as well to the typical medications that are used for migraine headaches. So if you've been experiencing migraines for years and you go, gosh, I just don't seem to be better, and you bounce from neurologist, 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 or doctor to doctor to doctor, and your headaches aren't getting better, we might have the wrong diagnosis because treating it like a migraine is likely to fail. So that's very commonly seen. Now, the symptoms that we're going to feel with this can be a headache, tightness, tension, throbbing, etc. Typically with occipital neuralgia, you can, but not always, see some visual aura in the eyes, like little blurry things, floaters, a little dead spot in the eye temporarily, visual disturbance, nausea, vomiting, etc. That can be very common, and that can be difficult to tease apart with a migraine headache, but if we look and listen well. Now, I want to key into what I just said there, which is look. Now, many people with headaches have never really had a good formal physical exam. We go in, you talk to the doctor talks with you a little bit, but never puts hands on to see. And there are certain ways that we can diagnose if this is occipital neuralgia by taking a really, really good look at you with a physical exam. Now let's talk about treatment, because this is kind of the key. Is occipital neuralgia is from a pinched nerve. So the key becomes with this one, getting pressure off the nerve. Now, medicines are oftentimes unsuccessful because that doesn't necessarily always take pressure off the nerve. And this is where you see people kind of stuck in this kind of cycle of, hey, I take a pill, I get temporary relief, the headache comes back, I take a pill, or I switch pills, I take different pills, I take a muscle relaxer, I take a painkiller, I take an anti-inflammatory, but the symptoms come back. And of course, if there's still pressure on a nerve, of course it's going to come back. So medicines, I'm a prescriber, so I do use medicines for some people. But if they're not winning in 30 days, that tells you to do something else. So other things that can be done. When the occipital nerve is trapped here right behind the ear, one of our favorite treatments here that we do is we'll get our medical massage therapists out and do a little bit of medical massage therapy. Oftentimes there are many different styles, but active release therapy, kind of doing some stretching through that area. Occasionally they can do some Graston or some other massage techniques through there. But that being said, there's many different types of massage that can be done. But medical massage therapy can be fantastic through this particular area. Number two is some people have gone through Botox for these successfully, and Botox can come through and loosen up some of the tight muscles by doing Botox injections. We can loosen those muscles, which then if the nerve is pinched in the muscle, it relaxes the muscle so the nerve isn't pinched anymore. So Botox can be helpful. Many people have successfully seen Botox work for them. There's what's called an occipital nerve block, which is taking a small needle and inserting it right up on top of the occipital nerve. It's typically pretty painless. It's a small needle, and it's much like a COVID shot, pretty painless. But you can inject an anti-inflammatory up in this area to reduce the inflammation and swelling in the muscle, to reduce the tightness and tension. One of our favorites, I will say two of our favorites that we use working through the occipital nerve. First, let's talk about chiropractic care. I'm not a chiropractor, but we have 4 amazing ones here. And by looking through the upper cervical spine, if C1 and C2, where the occipital nerve generates, are out of position or misaligned, there are ways to get pressure off the nerve by putting the spine back into proper position. Now that can be a chiropractic adjustment. Some people go, oh gosh, chiropractic adjustments make me nervous. That's okay. It makes a lot of people nervous when they come in. We have other ways that they can adjust through there with instruments and tools rather than manual adjustments. And a lot of people just get nervous about this manual adjusting through the cervical spine. And that's very common, and that's okay. But there are ways that chiropractors can work with you that are very safe. And oftentimes, perhaps you've heard from the family doctor, a neurologist, etc., don't see a chiropractor. Well, that's like a chiropractor telling you not to see a neurologist. So I would suggest if you've been struggling, you're seeing these people, and they have said don't see a chiropractor, you should probably see one, because there are ways that they can work with you that are very safe and not the traditional manual adjustment that can still be effective. So it can certainly be an option. Now, in some cases, they look and they go, no thanks, this isn't safe. But you should let a chiropractor make that decision. Number 2, Mckenzie therapy. Mckenzie therapy is a New Zealand style of therapy that we use very commonly here for nerve issues, whether it's sciatica, spinal stenosis, occipital neuralgia, pinched nerves in the neck, sending pain down the arm. Mckenzie therapy is a type of physical therapy, but it really, the key with it is it doesn't strengthen. And if we strengthen problems like occipital neuralgia early on, sometimes we irritate them and make them worse. So we don't like using like the traditional American therapy where we're, hey, strengthen, strengthen, strengthen. Sometimes that's not the thing to start with. And what Mckenzie therapy does is it works on a simple principle we're just going to call red lights and green lights. And red lights and green lights are ways that we can move these joints and find red light, we pinch the nerve, make it worse. Green light, we move the joint, take pressure off the nerve. So we need to find all of the proper red lights, all the proper green lights, and then apply stretches only into the directions of green lights, which begin to reduce the nerve pressure. And that can be extremely effective. Now, not only does it reduce the nerve pressure, but it can help to restore motion back to the joint if it's really fixated and stuck, kind of like the Tin Man in the Wizard of Oz. So if you're suffering with headaches, if you've been dealing with these things for years, again, they've been refractory to the typical conservative care that you've seen with medications, and you just, despite taking medicines, you feel like you're stuck, be happy to take a look at you. And that would be step 1, is just take a good look, get a really good history, do a good job listening to you, and a really good detailed physical exam. We do that well, we'll likely have a better understanding of where the problem's coming from, put that together with some imaging, have a better understanding where the problem's coming from, and then we can find out how to treat it. Too often, we never firmly establish our diagnosis in medicine, and when we fail to do that, oftentimes we're treating what we don't know, and we need a good diagnosis. So again, you can find us online. You can do a quick search. You can go to ohiopain.com on the web, and you'll find tons of information. I'll have to scroll through a little bit of the website to find occipital neuralgia and headaches, but it's on there. You can find us on Facebook at Advanced Medina. If you have questions and you see this feed, feel free to type in the comment section, or you can instant message us. You can also contact us directly via phone or text. The way to text us is 330-242-7669, which you'll see in the bottom of this video. And you can also find us on Instagram at advanced_spine, and you can find us on YouTube. You guys have a great week. Enjoy this nice cool weather this weekend. Next week, we're going to talk a little bit about car accidents, patients that have been in car accidents, Too often patients are in car accidents, they go get an attorney, the attorney has someone they like working with, and they get referred to these people that the attorney is with, and then we see these smoldering problems that just don't seem to improve following car accidents. That's going to be what we talk about next week. Folks, have a great week. Thanks for tuning in. We'll see you then.